Hello, my beautiful paddlers. Today we're going to talk about the lower back. I'm going to split it to two videos because this is a lot more complicated. Um, but I will still try to oversimplify it for your sake. If you do have any problems with it, make sure you consult a professional. But a lot of us dragon boaters have lower back problems. I'm going to explain the anatomy, why you might feel that problem, and what you can do about it. So first, to know the why, you need to know the what. So what's going on? So what's anatomy? So there are three main muscles that you can injure while you're paddling. One of them is your deeper muscle, your QL, your quadratus lumborum. It goes from your floating rib for most people. Most people, it's like your rib 12, and it goes to your rib 12 to your iliac crest right here. And also goes from your T-piece, your transverse process of your lumbar segments, to the same attachment point at your iliac crest. So what it does, muscles only pull, they never push. So you can imagine like a string right here and here, and it pulls it towards each other. What is it going to do? It's going to side bend. It's going to do, it also has some involvement in ipsilateral rotation as well. So to explain, now that you know the what of the major muscle, why? So as a paddler, for myself, for example, I'm a left side paddler. So say I'm sitting, left side paddler, I'm leaned outside. Say that isn't the case that I'm a good paddler and I'm leaning out. But I'm leaning outside, and guess what? If I'm trying to get this butt cheek off the bench, because good paddlers are always on one butt cheek, I have to lift this butt up. So see, this isn't the case that my butt is on the bench, both of them. And now that I want to lift this butt off the bench, I lift it up like this. Guess what? This one goes up. Now I'm contracting this QL constantly the entire time. Imagine doing a 2K, you're just lifting that butt up the whole time. You're contracting your QL the whole time. That's how you get a strain. You can make the same case for your outside back, outside back as well. So I'm left side, so I'm sitting, I'm leaning outside. You see a movement here? What am I doing here? Side bending, very little rotation. I mean, you're gonna rotate forward and backwards anyways. That's one reason why you're gonna put it on stretch and you're immediately yanking it back. So that's one reason why you're gonna get lower back problems as well, because you're putting on stretch and then you're immediately contracting it. Also, it's just doing its job, but at the same time, when you overstrain it, just overwork it. It's really normal to overwork that muscle. You can see how it gets involved. Just the posture itself, being on the boat, is already straining it. And now, on top of that posture, you have to work that muscle despite that posture. That's why a lot of people get that muscle hurt. So when you're leaned out like this, see this motion, I'm instantly contracting that muscle. So that's why your QL is a big contributor for a lot of people to injure or strain. Your other muscle is your more intermediate layer of muscle, but it is more deeper if you're talking about just the spinal segment itself, which are multifidus. It does really similar things to your QL, but at a much smaller specific scale to your spinal segments. It is a bigger muscle that does bigger gross movements. This is more specific movements to just the spinal segment itself. So to engage this is more like core bracing and then moving sideways, but also doing stuff where you don't engage the bigger muscle first. So things like maybe you're standing like this and you're just reaching the side of the side of your pocket. Whereas like if you use your QL, you're going all the way to your knee. So like you see this is I'm engaging my QL. If you're just like doing like this, just a little nudge, that's more multifidus engaged involvement. So this is very important for like stabilizing your spine though. The third muscle, your erector spinae, the bigger muscle, it's more so like here-ish. I like standing muscles, 3 muscles per segment. So 3 muscles in the lumbar spine, 3 muscles in the thoracic spine, 3 muscles in the cervical spine. So 9 muscles total. That's your main extending muscle. If you extend your back, and it feels like tiring. Like I guess if you hold it a good strong contraction for 5 seconds, it starts straining. It could be a lot of things. Just oversimplifying it, it could be your erector spinae. The best way to contract the lumbar spine erector spinae though, instead of like moving this way, like your upper, like a lot of people would just lay on a bench and they would just do like Supermans or like W's where they like face down on a bench and they just lift their arm. That's more so traps, and like if they extend their back up, they're using more like the thoracic portion of it. But to engage it better, you can like sorry, I'm gonna show you guys my ass again. So if you're like leaning on a table like this on the end of it, and then you can. Oh, I'm gonna accidentally lift the whole table up, but like this gives more involvement to your lumbar spine segments of your I like standing muscles. There's so much to talk about. I'll do rehab exercises in another video, but those are main three muscles that you might think of when you think of like back pathologies. Now we're gonna talk about like joint pathologies. So you can get SIG dysfunction. That deserves another video. But like the more common lower back pathologies, you can have disc bulge. So a disc bulge is when your lower spine is supposed to like be like this lordotic curve. But if you do a deadlift, so you round it too much, and there's a lot of stress coming out of it, your disc. Say this is the intervertebral disc right here. You round it too much, it literally like it comes out of its own original like alignment. It pops backwards into the spinal cord, and when it presses in the spinal cord, that's a big problem. It will press, like, since it's the spinal cord, it will shoot a lot more down towards your knee, and it aggravates more inflection. Another thing that you can hurt is sorry, I was looking at the time. You can hurt your psychopophyseal joints, facet joints. So these are keeping it simple. They're like more so like they're medial to your transverse processes, but lateral to your spinous processes is like in the middle. It's like the side area. So they form the facet joints. They form a little foramen where nerve endings go through, and when you extend your back, the facets stay closed. And they're also synovial joints, so there are little sacs in it. If that little synovial sac is inflamed, or there's any inflammation pathologies in it, it will pinch into the nerve endings that come out of it. Those are a lot more local. So to tell the difference between the two, if your pain hurts while you're flexing your back, it shoots down your leg, you can look up a test called slump test. It aggravates that exactly. It's more likely a disc bulge. It hurts more in extension and rotation at the same time. You're literally grinding, you're pretty much grinding the facets. And it hurts there, and it's more localized and doesn't shoot past the knee. It's more so a facet joint issue. With that said, I have no more storage. I'll make another video on rehab exercises on another video.